Please take your seats. Thank you. My computer is charging, so I can't use it. It's right here. I didn't realize it was going to run out of charge. Okay. I'd like to call to order the County Board meeting on Thursday, February 20th at 6:30 p.m. Would you please have a roll call?
Schwartz. Alex. Bergson. Carter. Cowart. Esri.
Here.
Harper. Here. Harkey.
Here.
James. Here. Jay.
Here.
Kibler.
Here.
Langenheim.
Here. There ain't no coffee cups, so you're not.
Maxwell. McGuire.
Present. I'll see if I can find some help.
Michaels.
Here.
Mitchell.
Here.
Petrie.
Here.
Quisenberry. Here. Richards. Rosales.
Here.
Schrader. Kurtz.
Here, we have a quorum. Our prayer and pledge. In acknowledgement of birthdays, Voltaire stated, "God gave us the gift of life. It is up to us to give ourselves the gift of living well." As we celebrate the 181st birthday of Champaign County today, let us focus on our own decisions, plans, and partnerships that will give the citizens of our county the ability to live well, both now and in the future. Amen. Pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Read the notice of the meeting, please.
Notice is hereby given that a regular meeting of the Champaign County Board, Illinois will convene on February 20th, 2014 at 6:30 p.m. in the Lyle Shields Meeting Room, Brookings Administrative Center, 1776 East Washington Street, Urbana, Illinois, in said county for the purpose of allowing and ordering payments of claims against the county, receiving and acting upon reports of committees, and such other matters that may be brought before said meeting, which said meeting shall continue in session from day to day until the completion of said business.
Can I have a motion to approve? Max? Stan? Thank you. Roll call vote, please. Any discussion? Oh, we don't need a roll call, sorry. All in favor? Aye. Opposed? Motion carries. Approval of the agenda and addendum. May I have a motion? John and Stan, thank you. I'd like to move one item, the Justice and Social Services area of responsibility at the top of the agenda, please, because of certain... What, yes, go ahead.
There's also a correction, the item 4B under policy on your written document, that should be ordinance 943.
Talking consent agenda.
But it's on the agenda, it's just a correction
Oh,
to
okay.
approve, with the approval of the agenda.
Okay. And I'd like to move Justice and Social Services to the top of the agenda, if that's okay. All right. Any other discussion on the agenda? All in favor? Aye. Opposed? Motion carries. Date and times of the next regular meetings are listed: standing committees, committee of the whole, county board meeting, and the study session, which will take place next Tuesday evening at 6:30. And now the consent agenda. I'd like a motion to approve, please. Whoa, James and, I'm sorry, give me Ralph. Thank you. Any discussion on the consent agenda? Roll call, please.
Schwartz.
Yes.
Alex. Yes. Bergson. Yes. Cowart. Yes. Esri.
Yes.
Harper. Yes. Harkey.
Yes.
James.
Yes.
Jay.
Yes.
Kibler.
Yes.
Langenheim.
Yes.
Maxwell.
Yes.
McGuire.
Yes.
Michaels.
Yes.
Mitchell.
Yes.
Petrie.
Yes.
Quisenberry.
Yes.
Richards.
Yes.
Rosales.
Yes.
Kurtz.
Yes. Motion carries. Thank you. Public participation is next. We have two. 5 minutes each, please. Mark, I'm sorry, Enslin? Is that how it's pronounced? Hope I pronounced that correctly, sir. Good. Please give us your name and turn on the microphone in front of you, bring it towards you, and there's a button right in the center. There you go. Thank you.
Yes. Okay. My name is Mark Enslin. I live at 207 Indiana Avenue in Urbana. And I'm here to speak. I understand that there will be some action taken in relation to reentry of people who've been in the jail. And I think it's a great program, and I'm glad that you're moving forward in it. And it moved me to go back and look at the report that the Community Justice Task Force made, which I really admired. I thought it was a really great document. And so just in kind of reminding us all of the context in which this is coming in, the 10 points that were in the executive summary of that report included, or at the top, shifting to an integrated restorative justice principle throughout the criminal justice system in the Champaign County. And I just have to say that one piece is really admirable, and I'm really glad that the county is moving in that direction. Expanding pretrial services. I understand that there was a forum on that issue from the state's attorney. I was not able to attend, and so I don't know the content of that, but just that discussion is there, I find encouraging. Developing a coordinated system of care for behavioral health services, mental health, and substance problems, and this is something that it's a long road, but I'm glad that this is moving forward, and keeping attention on that is why I'm reiterating this. Expanding community diversion and sentencing sanctions, establishing a reentry program. As I said, I understand that that's a direction you're going, and again, these programs are in the developmental stage, and so it might be wise to think of the steps that you're taking as action, as well as information gathering, trying out, experiment, and development, so that there may be mistakes along the way, and there'll be a learning process, and I think that should be considered positive, actually. Among the 10 points also was creating a racial justice task force, since that's an aspect of problems with incarceration in the county as well as across the country that I have spoken before about here. And again, it's a large problem and requires fresh thinking and how to address that, since there isn't really a simple thing to do. It's a complicated problem, and yet it's still a problem and should not be just pushed aside. So heeding that call for a racial justice task force from the Community Justice Task Force, I think it was a good thing to remember. And the last on the 10 points was engaging the public and criminal justice officials in thinking about systems change, which kind of loops back around to the integrating restorative justice principles. So, encouragement, that's what I'm here for. Thank you.
Chris Evans, District 8. Thanks again for enduring public input. I want to speak to the comments I saw by County Board Schroeder, who unfortunately feels that we haven't done a thing about the downtown county jail, and the idea of rebuilding out at the satellite jail, more jail building seems to come back up again. Just to review a few things, the county taxpayers, as you know, would like a reduction in the incidence of crime. And the more arresting and the more jailing that we do creates more poverty and more crime. Now, we have plenty of jail. In fact, we could close the downtown jail and just use the satellite to handle violent crime. I don't think any of us in here disagree that housing violent criminals in the county jail is probably to our best interest. But the way we prosecute in Champaign County doesn't just involve violent crime. And what the taxpayers really want is a reduction in the incidence of crime, such that people have their substance abuse issues addressed, and people are getting gainful employment instead of becoming tax liabilities. It's kind of unfair that me as a taxpayer who comes to a parking lot to find my car broken into and finds that my electronics have been taken out of my car, that the next day I have to go back to work, I have to fix myself meals, I have to take care of my kids, do my laundry, take care of my cooking, take care of my house, and then do the whole thing over again, while the offender who stole stuff out of my car gets to sit all day and watch television and eat Little Debbie snack cakes. So the injustice of just using the jail as a poorhouse or a warehouse, it's not fair to anybody on any level. So any alternatives that we can create to keep people working, to keep people out of trouble, and address their issues is where we want to go. And certainly, we want to do something about this 50% recidivism rate. The jailing method isn't working. People come back, come out of the DOC with nothing, and reoffend again. So those are the kind of things that we're trying to address with reentry. And that was what we've been working on for the last 2 years. Just as a reminder, I know you do know that. As far as the downtown jail goes, I'd like to hear those what makes the downtown jail so awful. None of you would file a class action lawsuit on behalf of the inmates that are in that downtown jail, using as your defense probably the Illinois Department of Corrections annual inspection, which always gives the jail a passing grade. So unless you have some legitimate reasons what makes the downtown jail awful, and if it's just peeling paint, poor lighting, and it's dingy, that's not a whole reason to go into a $10 million, $20 million capital improvement project. So give us good reasons what makes the downtown jail so awful, and as you talk, realize that you're really creating a class action lawsuit for those inmates that are having to be housed there. Thanks again for enduring public input and listening. Thanks a lot.
Is there anyone else who wishes to participate in public participation? I don't see any. I'm closing it now. Thank you. Communications from the board. Any communications? Ms. Petrie.
Yes, I just would like to let my fellow board members know and to the constituents of District 6 that Josh Harkey and I are having our 6th town hall on the Sunday, March 2nd at the Champaign Public Library from 1 to 2. And this time we are having Rick Manners, who is the director of the Urbana-Champaign Sanitary District, come and join us to talk about the actions and contract that the sanitary district is probably going to be close to passing in relationship to selling water for the Cronus project. Thank you.
Thank you. Any other communication? Ralph?
This one isn't really part of our business, but I have
Phone, microphone.
I've learned that the French government has decided to confer the Legion of Honor on anybody that was on the beach in Normandy on D-Day. So if you've got any buddies around here that you know of that fill that, put them on it. I've got the address of whom you're to write to and all that sort of thing. It'll take about a year to get it. As I remember it, the Legion of Honor rates a little bit above the Good Conduct medal, but anyway, it has a nice swing to it.
Thank you, Ralph. Was that the War of 1812 for you? What was that one? No, never mind. Okay. All right, let's continue on for communications. I have two. As you'll see on your desk, an announcement. Normal, Illinois will be hosting the McLean County Muhammad Aquifer Summit, which will take place Saturday, February 22nd. The moderator will be Steve Carter, the retired city manager. There'll be an entire program. of oversight of the Muhammad Aquifer sole source designation application, legal challenges by Joe Hooker, and why we need to protect our aquifer, remarks by selected local, state, and federal officials. I was invited to be one of those speakers. Then we'll have lunch and then a citizens advocacy panel in the afternoon. So, and it's open to all in Normal, Illinois, and many of the community and elected officials will be in attendance. Secondly, a letter was received from the Douglas County Board Chairman, Charles Knox. Discussion, I won't read the whole thing, but it's a discussion about the I-5774 concerns that they have as well in Douglas County. Let's continue. Are there any other communications? Okay, thank you. Let's move to the approval of the minutes for January 23rd, 2014. Motion, please. So moved by Aaron. Do I have a second? I'm sorry. Astrid. Thank you. Any changes, discussions on the approval of the minutes? All in favor? Aye. Opposed? Motion carries. Mr. Scott Gima, it is your turn. We now will have the nursing home quarterly report, and it is on your desk. I'm sorry. You're right. Sorry, Scott. We moved up justice. Astrid, would you please take number A1? Sorry, Scott. Turn on the microphone, please, Astrid. Thank you.
Move adoption of resolution 8769 approving contract with Community Elements for reentry programming and for the county of Champaign.
Need a second.
Second.
Second by Ralph. First. Discussion. Roll call. Okay. Do I have a second under roll call?
Second.
Second. Okay. Discussion. We'll start with Jeff, and then we'll go to Max.
Just to echo a sentiment that was made during the committee of the whole, in the current plan that we see before us today, it didn't have the documentation that was provided at the COW with respect to what community elements is, what their goal is, that sort of thing. One of the topics that was discussed was the target demographic for this set of monies. And in it, it stated that those afflicted, or excuse me, those receiving money from the Mental Health Board, so those afflicted with mental illness, would be excluded from this pool of monies. I thank the sheriff and the representative from Community Elements to clarify that statement. People who will, who do receive some money or funding or whatnot from the Mental Health Board within the jail will still qualify. So that is a big relief for me, so thank you for that clarification. I would love to see all of this money go towards those with mental illness as opposed to just partial, but ultimately that does make this a lot more palatable than it did in the past. So for that, I probably will support this given the fact that it will be inclusive in focusing on those with mental illness.
Great. Thank you, Jeff. Carrie?
Thank you, Mr. Chair. I, too, am concerned that the folks that truly can't help themselves, and that includes the folks with mental health issues, I would like to see them get the help that they need, and hopefully this program can be blended in with the other programs to accomplish not only the recidivism, but also to help those folks with mental health issues. Perhaps by getting a person the right home might help with the mental health issues. So hopefully we can make this program work for those folks that suffer from mental health issues. The other thing that I'd like to say, and perhaps it's time to say it, and occasionally I'll do that. This program is not likely to solve our classification of inmate at the county jail. We have a classification problem. Reducing the census by a small amount is not going to correct that. We're going to have to make some modifications to our physical plant. And I suggest and highly recommend that it's now time for us to begin the planning and design process for modifications somewhere within the jail system, wherever most appropriate. Likely the satellite jail, but I believe it's time to start this process. Thank you.
Thank you, Gary. Is there any other discussion on this issue? First Chris, then Patsy.
I'm in support of this proposal. I mean, we've heard a lot of public comment on this over the years. I mean, I think we need to reiterate and remember ourselves that the county board specifically, our role in the justice system is somewhat limited and clear as mud. Maximizing the efficiency and the fairness of administration and justice in Champaign County is something that the county board needs to play a role in, but is no longer, is by no means the only actor in. That being said, you know, this reentry program is something the county board can take the initiative on of our own accord. And so I'm looking forward to seeing the county move forward with this program. You know, I think the sheriff's made the case in the past that this is not going to result in a dramatic reduction of the number of people who are in jail. Most likely, it's a small program. It's essentially a pilot program, but it will help. He has also made the point that it will help the people who are have the opportunity to go through the program. And if this helps keep people, you know, out of jail, helps break the cycle of recidivism that Mr. Evans referred to, if even for a small population, then I think it's worth doing. I acknowledge what Mr. Maxwell said. I mean, I think the efforts of the sheriff and other stakeholders in the justice system have been to some extent bearing fruit. I mean, there are still people in the jail, but the jail population is the lowest it's been in 10 years. However, you know, it's not going to help the fact that the jail is still the mental health facility of last resort, and we don't have very good facilities for housing people with mental issues. We don't have very good facilities for dealing with people who are incarcerated who have medical problems. And the satellite jail, or neither the satellite jail nor the downtown jail, is an optimal facility for housing women. So, I mean, I think Mr. Maxwell says this well. I mean, let's look at the facilities we have. Let's figure out what the optimal way to get from where we are now to where we need to be in terms of making sure that the people who do have to be in jail are able to be taken care of safely. So I'm going to support this project tonight, but I'm certainly also not opposed to you know, continuing this process of looking at the condition of the facilities and possible future options for the facilities, following on with the you know, the recommendations that were made in the ILPP report.
Thank you, Chris. Patsy.
Yes, I too am going to support this, but I do have two information questions. One of those questions I sent to Ms. Busey this afternoon, and that is, will the Reentry Commission fall under the Open Meetings Act?
And I did respond to you.
Oh, I'm sorry.
The Reentry Commission is being established by Community Elements, who is not subject to the Open Meetings Act.
Okay, and then may I ask a question of Community Elements? Can we bring them to the table?
Absolutely. Would you please?
Sheila, thank you.
Do we need to suspend the rules on this? No? Okay.
Hi,
Hi, Sheila.
Please
Thank
introduce
you very
yourself to
much.
those who may not know who you are.
Sheila Ferguson. I'm the CEO of Community Elements.
This question really pertains to the year hence because it's within the contract potential renewal year by year for 2 years. And I just wanted to set things up for the next board, who would be the board to doing this renewing, so that they would have enough and sufficient data to make their decision. And when I read the proposal, I did not see anything in the proposal that indicated that there would be formative and summative evaluations of the progress of the program as you are moving along. Is that something that maybe just wasn't typed out in the program outline, but you do have that in mind to do?
We actually do use a couple of tools within our own quality assurance at Community Elements. We have a client rights program, and essentially that's a third-party evaluator. We do an evaluation of all participants, and then those are sent, and then we review those actually fairly regularly. Depending on what the team recommends, those could be done every 3 months with everyone who's been through the program, or every 6 months. And so because we have different programs, we touch people's lives at different points, some of them longer term, so that makes a difference with when we decide. Like, I would think for this program would be each person who was in the program would participate in giving us feedback for quality improvement.
Thank you for that assurance. I appreciate it.
Are there any other questions? James? What's that? I have a comment, not a question. Okay, you want to comment to her? No, okay, thank you very much. We'll call you back if we have any other questions. Thank you. James, go ahead.
Yeah, I just want to add my name in the list of folks who intend to support this. When we voted for our budget, it had an intent of doing this, and as well, it had an intent of addressing some facilities issues that we know we have. We can't deny that we don't need to improve our ability to support prisoners who have health issues and who have mental health issues within our current model. So I think moving forward on this is just fulfilling part of that commitment that we made when we passed that budget, which is a document of principle as well as our plan for spending money. So I encourage everyone else to support this.
Thank you. Are there any other comments? Yes, John.
Actually, I was not going to support this tonight when we come. I've been afraid of the opening Pandora's box and not being able to control what we've opened, but and also concerned about us ignoring what we really need to be looking at also, and is how to correct the deficiencies in the jail system, which does not mean we have to build a new jail. I'm just sick and tired of hearing that, but we'll hear it until we do something probably. But I am pleasantly pleased tonight to hear the comments from both sides of the aisle that we need to move forward with this, and that we need to take into consideration at simultaneously or thereabouts as close as we can be how to solve or at least start working on the other problems. So I'm probably going to support this tonight.
Thank you, John. Are there any other comments? All right, let's go to the roll call, please.
Schwartz?
Yes.
Alex? Yes. Bergson? Yes. Court? Yes. Esri?
No.
Harper? Harper?
Yes.
Harkey?
Yes.
James? No. Jay?
Does maybe work? I'm sorry, sir. We don't have a maybe.
Kibler?
Yes.
Langenheim? Yes. Maxwell?
Yes.
McGuire? Yes. Michaels?
Yes.
Mitchell?
Yes.
Petrie?
Yes.
Quisenberry?
Yes.
Richards?
Yes.
Rosales?
Yes.
Kurtz?
Yes. This motion carries. I want to thank everyone. This is what makes me feel really good when we can have bipartisan support for an issue that is countywide, that will be able to help in a safety of our community. And so I want to thank each and every one of you. We promise down the road that we will discuss all issues concerning our justice system, jail situation, and the reentry program. So I want to thank you again. Let's move on. Let's move to the nursing home report. Mr. Scott Gima. Thank you.
Just keep everything under lock and key. I don't want anybody going to jail.
Good evening, everyone. Quick correction. I didn't notice this until about an hour ago, that it should say first quarter of 2014 update. It says fourth quarter of 2013.
We're not going to go through a whole year, too, are we? Thank you, Scott. Okay. Just want to make sure we don't.
Okay. And yes, I proofread my document about 4 times, and I still missed that. So topics today, census, financial position, cash, food service, and we're going to talk about quality. Embedded in there is also, later on, we'll be talking about the turnover rate. Census. This slide summarizes the average census for each of the fiscal years from 2008 to 2013. So you can see, obviously, 2013 was a down year. So for the year as a whole, we averaged out about 188.8 residents, which is down from just under 200 the year before. But compared to where we were back in 2008, we've made significant strides in getting our census up. But without question, again, 2013 was a down year. And I think I've talked about this before. I mean, you can see the census in 2013 was just all over the place. We started off the year in December of 2012 at about 205 residents, but basically through the spring and the summer months, we saw a significant decline in our census to a low point of 179 in May. But over the course of the fall and through the winter months, in particular December of 2013 and January, our census has climbed back up to over 200. And as of yesterday, as the 18th, our census was up to 210. I believe today our census was down to 208. We've been averaging about 16 to 19 Medicare. We're actually seeing more VA referrals. Right now we have 2 VAs, but we've been averaging almost 4 VA residents so far this year. I know it's just a couple of months, but we have also, as a sidebar, renegotiated our VA contract, and our rates for our VA are over $200 per day. And the VA has stated that they will probably be referring more business to us because they've actually reduced the number of long-term care beds in their system in the state.
Hold on, Scott. Chris?
So Scott, is that essentially a fourth payment category? Is the VA essentially a fourth payment source?
Yes.
We haven't heard much about that in the past. Okay, but we do have a rate for them.
Yes.
And they do occasionally send us people?
And it probably, I've never mentioned it because the volume has typically been low, but we've really been pushing over the years to try to get a higher reimbursement rate from them, and now we're starting to see more census. And even historically, we've seen a lot of respite stays with VAs.
That's what I was going to ask. What would be the typical patient? Are they essentially, is it more of a rehabilitation situation or more of a respite situation or long-term?
Historically, it's been short-term respite stays, and
Okay.
those are typically, maybe 2, 3, 4 weeks.
So people who were probably admitted to the VA and then discharged in essentially a hospice situation?
Respite is actually typically, the caregiver needs to go on vacation or take a trip and basically places their loved one in the facility just for a short period of time.
Oh, I'm sorry. I completely was going down the wrong road there.
Yeah. So, but now we're starting to see more long-term VA residents being referred to us.
Okay, thank you.
Jeff?
Mr. Gima, how are they being classified in this particular slide? Are they considered Medicare in that case? Or how are you denoting them in terms of average census? We actually separate them out. I mean, they're included in those totals, but we do track the VA residents separately. So they are not embedded in either of the private pay, Medicaid, or Medicare categories. But it would be included in the total amount. Okay, thank you.
Okay, continue, Scott.
Now, again, what we see with Medicare, because it's a short-term stay, the census fluctuates from month to month, week to week, day by day. But as you can see, over the last 2 months, our Medicare census has increased. We were at 19.5 in December, 18 in January, and again, so far in February, we've been anywhere from 16 to 19 to 20 Medicare residents. So again, we saw a downturn in our census in fiscal year 2013. And again, the reason is not because we saw less referrals or admissions to the facility. This slide shows that since December of 2011, there's been a slight increase over time in the amount of admissions. Again, in 2012, we averaged about 22.2 admissions per month. In fiscal year 2013, we averaged 25.5 admissions per month, which is a 15% increase from the 2012 average. And again, you could see, we had a couple of months there during the summer, we had 39 and 37 admissions. In December, we had 30 admissions. So we've had some really, really strong months through the course of the year. Okay, so the question is, why was our census down? And again, I've mentioned this before, we sent a lot of people home. In particular, our Medicare residents who were short-term stay, we had a high percentage of those go home instead of some percentage of them becoming permanent Medicaid or private pay residents. But the reason why you see the uptick in our census in the last 2 months is that our discharges have dropped over the last couple of months. So in particular, in November, we had 27 admissions, 21 people going out, net of +6. In December, 30 admissions, 24 going out, +6. In January, we kind of broke even. We had 19 admissions and 20 going out. So earlier in the year, in the summer months, we would have, those numbers aren't in the slides. During the summer, we may have had 25 admissions, but maybe we sent 30 people out. And that was consistent during those summer months. So the decline in our census in 2013 wasn't because people didn't want to come to our facility. It was primarily because we were sending a lot of people home. Very quickly, next two slides are payer mix. This one is based on resident days. Again, from 2008 to 2013.
So looking at this slide for fiscal year 2013, that seems to add up to 100%. Does that mean if we had any veterans in there that we were paying for, where are they represented in this?
This slide probably actually just took the three main payers, Medicare, private pay, and Medicaid, and basically ignored our VA.
Okay, so these numbers wouldn't add up to the, if we had the numbers, they wouldn't add up to the total census for that, for those
Correct.
periods of time. Is there any reason why we wouldn't start seeing that reported in the future,
I can do that.
if it's going to become more common? Thank you.
So the payer mix over time has improved, meaning that we've reduced our Medicaid payer mix and we've increased or attempted to increase our private pay and Medicare. Now, in this chart, you would see that our Medicare payer mix has not really increased, but actually has decreased over time, which is the bottom line. And private pay has shown a moderate increase. But if we do our payer mix for Medicare, Medicaid, and private pay based on revenue, you see a much more dramatic change over time. And it's because of this change in payer mix that in fiscal year 2013, which I will talk about in just a second, financially, we basically kept our head above water. Not by much, but we did. If we had the same payer mix that you see there in 2008, in 2013, we would have lost a fair amount of cash. But because we've changed the payer mix over time, it's been able to give us, if you want to call it, more revenue bang for the buck in 2013 compared to 2008. So again, this doesn't mean that we're getting away from taking care of the Medicaid, but we have to change that payer mix in order to keep the financial position of the home where you guys want it to be. So for fiscal year 2013, the net income was a minus $307,000. You add back depreciation, cash from operations on paper showed $426,000. However, you had the $333,000 loan write-off earlier in the year, which...
Right. Hold on a second, Scott, I'm sorry.
Yeah, before we get too much further down this, I just want to ask this question. With that adjustment in the payer mix that you just showed us, we're not turning away any Medicaid patients, right? That adjustment is happening just because of who's coming to us.
Yes.
And we're not denying any Medicaid patients access?
No.
Okay, good, thank you.
Now, hang on. The one caveat I'll make to...
Let him finish.
If I could just add in one little thing on that. It's not just about who's coming to us, but who we're actively seeking as well. we're actively trying to get more Medicare patients in from the hospitals and this VA situation as well.
The one caveat is we will not take Medicaid pending from the community. So those are individuals who are still waiting for the Medicaid approval, who have never been in a nursing home before, because, and this is something I'm going to mention a little bit later, the application process is taken and sometimes over a year. And we just cannot afford to take those Medicaid pending from the community. We will take them if they're coming from the hospital, if they're Medicare and then they convert to Medicaid, or if we have a private pay resident in the building who uses up their assets and converts to Medicaid, we keep those individuals. Other nursing homes across the state may not do that, but we will keep those. Again, our adjusted cash from operations after accounting for the write-off of the loan is we had a positive $93,000 cash from operations for fiscal year 2013. So again, not great, but we did keep our head above water. December of 2013, again, our census was about.
Rachel.
Can I go back for a second? So the 93,000, what you call adjusted cash, this is after the nursing home is paying the general corp for the over 300,000 of the loan. Is that correct?
Yes.
So if we didn't have to pay for that loan, that would be 93 plus the 300?
Yes.
Okay, thank you.
For the month of December 2013, our census was, again, about 201 or 203. We had a positive net income of 104,000. Adding back depreciation for the month, we had positive cash from operations totaling $165,000. This is the same numbers by month going back to December of 2011, and you can see for December of 2013, that has been the highest cash flow month that we have seen going back to December of 2011. And again, the census in January is in the 200s. In February so far, our average is about 205. So I anticipate that we should see pretty strong financial numbers in January and in February. My usual contract nursing chart, you can see that we've seen an uptick over the last couple of months over the winter, and basically it's because of the turnover that we've had over those last 2 months in filling those positions, plus the holiday months, has resulted in us relying on a little bit more agency nurse. Al.
You only have it up to November, you don't have December and January figures for us?
December.
Page 16.
December is in there, you just don't have it written down there at the,
I got it.
December showed a very short drop. You got it, Patsy? Right at the end there.
All right, this is the chart that shows our cash, accounts receivable, and accounts payable. Again, going back to about July of 2011. Our cash balance for December was about $684,000, which is up slightly, actually double from what it was in November, relatively speaking, which was $367,000.
James?
Do you have an explanation for our trending on accounts receivable going up?
You're giving me the segue to talk about Medicaid pending.
Okay.
Segue.
The Medicaid pending is what's causing our accounts receivable to go up over the last few months. And actually, anytime you see an up or you see a downturn in our accounts receivable, that's usually when we've had some of our applications approved. So for example, in January, you will probably see, or I hope you will see our accounts receivable drop because we had 900 days converted, including 2 residents whose application was in the works for about a year, so over 700 days. We currently have about 35 residents who are Medicaid pending, meaning that we are not getting paid anything but their resident income, which means a pension or a Social Security check, which is usually a small percentage of roughly $5,000 per month that we would get from Medicaid. This equates to about a lost cash flow of roughly $150,000 a month, or well over $1 million on an annual basis. This is a huge problem, not just for us, but for every nursing home across the state that takes Medicaid. And it's an issue that we've been working really hard with our associations. The state knows about it, and basically the problem is that they've shut down Medicaid offices across the state. And the workload for each caseworker has increased exponentially over the last few years. And they also refer almost every application to the state OIG office for further evaluation. And when that happens, don't hold your breath. That's when we start seeing delays of up to a year in our applications. That is the main reason why you see that uptick in our receivables.
Yeah, Gary?
Scott, recently we noticed that the payment cycle for Medicaid has gone from 60 to 90 days. Is that still holding?
Yes, it is.
If so, that does affect our cash receivables also.
Correct. The two main issues through the course of 2013 that impacted our cash is the increase from 60 to 90 days for Medicaid. That reduced our cash by 1 month, which would be about $250,000. The other item was that we consciously made a decision to get our payables paid down so that we didn't have to incur any finance charges. We did that roughly in about April or May of 2013. That reduced our cash at that time by about $170,000 to $200,000. In December and November, those are always high cash use months. Typically, we would spend about $1 million bucks per month to $1.2 million. In November, $1.5 million because of 3 payrolls. In December, $1.6 million because we had a principal payment of $239,000, plus a liability property tax payment to the county of $105,000. So again, anticipated cash usage in November and December. And again, it's one of the reasons why we still have to use the tax anticipation warrants to ensure that we've got cash flow going into the new year. Mr. Gima, can you give an estimate on bad debt? I know we had a concern about that late last year or early last year. Where do we stand with bad debt at this point?
I don't have any numbers off the top of my head. We'll probably have those as we're getting through with the audit within the next couple of months, I would assume.
Could you have those numbers for us at the next quarterly report? Thank you, Scott.
The Medicaid update, as Gary was asking, the Medicaid payment cycle is currently at 90 days. My contacts in Springfield are stating that tax receipts are typically strong for the state in the spring, so there is no anticipated changes or no expected payment delays, at least over the next few months. Food service. Food service continues to be an issue.
Before I forget, Mr. Gima, my apologies for interrupting you. In terms of monthly employment payroll, how much is a standard monthly payroll for the staff? I think that's going to be pertinent for the next four slides as we talk about employee morale, employee turnover, and so forth. Do you have a general idea of how much we currently pay in payroll today per month?
Wages are about $500,000 per month,
Thank you.
not including taxes and IMRF and other expenses.
You said not including?
Not including.
Okay, thank you.
You could roughly tack on about 20%, 25% on top of that. Food service.
Our food quality has improved over the last few months, but we still have ways to go. The biggest issue that we have is we need a food delivery system, because our biggest problem is consistent delivery of our food from the kitchen to the 4 dining rooms. We don't have the equipment, that's basically it. We were using steam tables previously. We've made a change where we are preparing all the plates in the kitchen. And the reason for that is because of IDPH. IDPH frowns on the use of steam tables in the dining rooms for 2 main reasons. One is a safety issue for residents. They have cited other facilities who use steam tables for injuries to the residents. And the second is sanitation. They've been citing a lot of facilities who use steam tables for sanitation tags. And collectively, with all the experts that we've been talking to, the system that we want to put in place is the direction we want to go, which is a capital purchase that we have included in the fiscal year 2014 budget. We actually issued an RFP in January, but we've had to step back mainly because the newspaper failed to publish the notices, and we had to go back and start from scratch again. But we hope to put this in front of the Board of Directors at next month's meeting. And again, we're talking roughly a $40,000 expense for a delivery system that will keep hot foods hot and cold foods cold as they get delivered to all the dining rooms. Employee turnover. I know there's been a lot of discussion about our turnover.
Mr. Gima, when you're talking about the RFP, are you talking about the management company that's supposed to be taking care of dietary?
No,
Are
it's
they-
a RFP for the capital purchase of the food delivery system.
When we talk about the food service and the dietary, my understanding from the last meeting that we had, that they were not fulfilling the MOU. Have they filled all the positions, and are they running dietary as we expected them to per the contract?
The simple answer is no. So we have voiced, continue to voice, and we are working with them, and there is a possibility that we may have to make a change in that dietary management vendor.
Have you and the board then discussed the agreed-upon payment to that contractor? Is payment being withheld since service isn't satisfactory?
Not yet. It's all part of the discussions that we're having with them at this time. Employee turnover. So in 2013, we had 129 separations. I know there's been discussion about the calculation of what our turnover rate is. The discrepancy is in the denominator that was used in the calculation. So our calculation was 40% and used a denominator that included active employees at the end of 2013 plus any employees that were employed during 2013. So the denominator that we used was larger. ASME's denominator was the 186, which gave them a 60% rate.
I presume those separations are not disciplinary, or are they?
It covers separations for any reason.
Any reason? Okay.
So without question, we have a high number of separations. I mean, back, I believe in 2012 was about 102, and I think it was 126 in 2011. So without question, we have a high turnover rate, regardless of what denominator we're using. Turnover is high in the facility. But as you can see in the second bullet, we had 59 separations, or 46% of all the separations in 2013 occurred during the 6-month probationary period for new employees. Now, we made a conscious effort a few years ago to change our hiring processes at the nursing home to try to improve the quality of the people that we're hiring. We started doing peer reviews. So if you're a CNA applicant, you will be interviewed by other CNAs, including management administrator, DONs. I mean, there's multiple interviews that we do for all our applicants. We drug test, they get a physical, but we also started doing a predictive index, web-based survey. So it's a 10, 15 minutes test that all our applicants do. And what we're trying to do is we have determined a personality profile for each of our positions to try to get a better fit with our applicants to our positions. Now, obviously, if we have 129 separations, despite everything that we've done, we still have a lot of turnover. And without question, it's not providing us with the perfect employee every time.
Real quickly, it seemed like a large part of, in my mind, some of this turnover came from that food service situation that was trying to be corrected. If you took some of that out of the equation, do you kind of have an idea of really what is turning over as far as the CNAs and the actual operations outside of that dietary food service area?
CNAs typically account for a significant percentage of the turnover. In 2013, food service was also a very high percentage, not quite as high. And it is reflective of the issues that we had with management in that department. But in addition to that, one of the other issues that we had specifically to dietary is that we did have a handful of existing employees who, how do I state it, was sabotaging the new employees. Basically, we're making their lives miserable. Maybe another way of putting it is they were bullying the new employees, and we had a lot of turnover in dietary because of that over the last few months. Now, we were able, through the disciplinary process and with our union steward's approval, we terminated these individuals, and we have a much better employee culture in dietary. So I think we're moving in the right direction. We still have an open position with the director. We have an assistant food service director who's doing a great job. We hired a supervisor a couple of months before we hired Curtis. She is doing a good job. So we're moving in the right direction, but we still need to get a manager in place. That is the one missing piece.
I just want to follow up real quickly, because that's been a concern for a lot of people. I have heard, though, and based on probably the practices that you have been working on, is that the care of the members at the county nursing home has been very good. And the nurses and all of those people have been very good. So I think that maybe some of these practices being put into place have a learning curve, if you will, and from there out should maybe flatten out a little bit, because from what I hear, the people that you do have there now are very good at what they're doing.
Thank you.
I think I'll start out the way Diane talked about, that, you know, obviously with the CNAs, the part-time CNAs they have brought in, that those staffs, those numbers have dropped, so more of the CNAs are staying longer, so that obviously they want to be there. The dietary is still an issue, of course, and we discussed that a little bit before the meeting started, but when you have 129 people leave, when the number that the union was given was 189, that's a huge number. And whether it's some staff, 46 people left from dietary in that year, if there are some staff that are grumpy, there's a lot more happening than that. And I think what we're seeing is more than just that issue. And I think it's the staff wearing on supervisors and lack of supervisors. And I want to hear something more than just, you know, it's staff. I want to understand what other changes are going to happen to fix these issues, because when you see more than 50% of the staff leave for 3 years in a row, you know, I want to see improvements in employment for the working conditions of the employees, but also, you know, how do we improve the care of the people that are staying there? Because that's what's going to improve the viability of the nursing home, and that's what we want to understand.
It's a very there are multiple variables that go into the turnover equation, and too much to talk about, obviously, now, but my offer to all of you is if you want more information, you can get my phone number, my email, you have it. You can talk to me, you can talk to Karen. More than happy to talk to you, because it is a very complicated issue. It also involves exactly what we're discussing with the union right now in negotiations. I mean, there are non-economic issues that I don't want to talk publicly about that we need to address that will help with the turnover issue. So we need their help, because I will agree, we have to get the turnover down. But as I'm talking about in this slide, the reason why we have so much turnover during the probationary period is that 6-month period is our opportunity to test those employees to see if we want to keep them around for the long term. And we have a number of reasons that we have those separations during the probationary period. In that 59, what I didn't have in that slide is 17 of those hires never showed up for their first day of work. So despite everything that we try to do on the hiring side, for whatever reason, they decided they didn't want to work at CCNH. At the same time, with just about every orientation class, now maybe they're always going to say positive things because now they're working at CCNH, but we hear comments time and time again that they've heard that people enjoy working at Champaign County Nursing Home versus the other nursing homes in the area. But getting back to this slide, poor attendance is an issue.
Let me make a comment before I go to Patsy. I would prefer that if they have any questions or emails, they send them to you. Karen's got a big enough job than to have 22 of us questioning her on these issues. So I would rather, if it was all directed in one area to you, if that's okay, Scott?
I'm fine with that.
Okay. Patsy?
Well, I would strongly urge to answer most of the questions that have been verbalized and probably are in my colleagues' heads, is that we be given a matrix that will help us look at the categories of separations. Being told there's 129, or if it's 186, if I'm listening to the union, as I heard when I attended the board meeting, and the 59 separations, we need this broken down to know part-time, full-time, how long they've been there, et cetera, et cetera. And you can do that. You said there are a number of variables that's easy to do, set it out in a matrix for us, and then we can start understanding it much better.
Is that okay, Scott?
Yes.
You able to break it down? Okay. We'll go on to James.
That's essentially what I was going to ask. I was going to ask, of these 129, how many of them were resignations, if you knew that, but if you don't have it handy, that's okay. The other thing I was going to suggest was this predictive instrument might be something we want to look at, whether there's an alternative that might be better. I mean, if you start, I understand why you chose to do something like that, but if it's part of the mix, either it's not predicting very well, or maybe it is working well and we're hiring people that are upwardly mobile with their skills and they don't stay with us very long. If we see a lot of resignations, they work with us until they find a higher paying job and then they move on. So I would encourage you to look at what that thing is doing for you now.
I believe that it is working. I mean, everything that we've done is working. And again, the largest barometer is the agency usage. And over the last few years, we have significantly decreased our reliance on agency nursing. I mean, a few years ago, we were spending well over $1 million a year, $150,000, $160,000 a month a few years ago on agency. So we are retaining more of our, we don't use any agency nurses. It's right now, we've eliminated nurses, it's all CNAs. And even that we've reduced over time. Will we eliminate agency? Probably not, because we always will maintain staffing based on census and acuity. We won't force overtime. We ask for overtime. We don't mandate managers from working overtime or working the floors, but sometimes they do. But again, we have 200 patients. We can't have the DON working on the floors all the time, and we'll burn them out. So we have to rely on agency, but we want to minimize that as much as possible. But because of our success in agency, I believe our hiring practices has improved. We just have to continue to try to work that so we get our turnover rate as low as possible.
Scott, on the issue of the breakdown, why don't you get those numbers together, shoot them out to me, I'll bring them out, I'll forward them to the entire full board so that we can get that question answered within, say, a week. Is that okay?
Yes.
Okay. Let's, for the first round, let's go with Astrid, who has not spoken yet. Please check your microphone. Thank you, Astrid.
My son and daughter-in-law tell me that some of those hiring tests are discriminatory against protected classes. Has yours been vetted for that sort of thing?
Before we implemented it, yes, it was vetted.
Thank you.
Thank you, Mr. Gima. I think everybody's getting to the point of identifying the different classes of folks who were terminated, whether willfully or unwillfully. What I would also like in that report is what current actions beyond what you've just stated, what new actions are being taken in each of those subgroups, because each of them will be targeted in a different way to reduce the number of people who don't show up for day one. I mean, that could be, well, we could come up with a whole host of things for that one. But what I would like to better understand is, specifically in the probationary period, a better understanding of the cost per employee that comes in that we lose after 6 months. What is the cost? Because that's really all pure cost at that point. The CNA is, you're not going to let walk the floor day one. You're going to have to be with him or her throughout a very extended period of time, and it's lost money. So understanding the cost metric behind this would also be very helpful, if you can quantify it.
Let's move on to Chris.
Pass.
Pass. Gary?
Thank you. I wanted to clarify one small point. It's just a technical point, but ASME and indicated there were 229 separations in 2013, and Scott is in agreement with that of 129 separations in 2013. So I thank you for reconciling those figures. Thank you.
Okay. We'll go to Patsy, and then let's continue to move on, please. Patsy?
Well, since we're asking you for things, I also would like to add to what I requested previously. You can cut down agency use by extending how much time people who are hired there are working, and I'd like to see if that is some of the mitigating that has allowed this reduction in agency use.
Can you state that again, Patsy? I'm not understanding what you're saying.
Are people doing double shifts, triple shifts, which then would reduce your necessity to use agency people? So I want to understand why this decrease has happened. Is it because of your more keeping of the people on staff? Have you extended the amount of time people are doing their duty? Things of that nature.
Rachel, would you?
Yeah, I mean, I think we deserve some information, and we definitely have the right to ask for that, but to go into lengthy projects of analysis, I would like Mr. Gima to run the nursing home rather than work on data analysis that we don't absolutely have to have. So I think we should be a little bit more reasonable about what analysis we are asking for and figure out that there is a trade-off on time of running the nursing home versus providing reports.
Stan?
Just a quick comment, Scott. If you get this all figured out and you get it working well, could you give me the inside sight? Could I make a lot of money off that program?
I'll work on it.
Okay, move on.
This slide summarizes some of the indicators that I believe that we've improved the quality of our employees. Over the last 3 years, we have significantly improved our surveys from IDPH. and our four-star quality measures have improved. Not all the measures, because we've had bad surveys 3+ years ago, but those will fall off probably within the next few months. Our four-star quality rating is right now 2-star. We just went from a 1-star overall rating to 2 stars in January. And yes, that is a poor rating. There's 3 components that goes to overall rating. The first is the surveys, which is the highest weight measure. Number 2 is staffing. We were at 4-star in our staffing. That includes, they look at RNs, nursing, and CNAs. Quality measures is the other star rating for which we have 4 stars. And there are a number of specific quality measures like the incidence of urinary tract infections, the incidence of falls that go into those quality measures. So we are 4 stars on staffing, 4-star on quality measures, but we are now 2 stars on our surveys. But we believe that probably by the next quarter, which would be April, when the 5-star rating is updated on Nursing Home Compare, that we will see our survey scores increase as our bad surveys fall off, because it's a 3-year look-back period that is used to determine our survey score. Census. Our census is strong. Admissions are very strong. And we have improving resident/family satisfaction scores. We have been using a company called Pinnacle for a number of years. And they do an independent survey every month of 15 random family members. And they ask, there are 16 different measures. So I'm not going to go through all 16, but the primary measure that we are hearing from our main customers, which are the hospitals and the health plans, is what is your rating on recommending the facility to others from individuals? And so this is a summation going back to 2009, and this is the annual summation. So in 2013, it includes roughly about 180, 185 resident surveys or family member surveys. And you can see, since 2009, we have increased our satisfaction score for individuals that would recommend our facility to other individuals.
Scott, what does this number mean?
It's on a scale from 1 to 5.
Okay, thank you. That's what I wanted to know.
So again, the
I was
national...
hoping it was 1 to 5 and not 1 to 10.
Yes.
Thank you.
But the national average is 4.39. So best in class is, I believe, 4.63 in the month of December. Now, I take the monthly statistics with a pretty big grain of salt because it's only based on 15 interviews. So those numbers can be easily skewed. But our score for this particular measure was 4.73 in January. We exceeded best in class. But these numbers are more indicative because it's a bigger sample. But over the last 5 years, we have seen an increase in this satisfaction score.
Rachel?
The national average including private nursing homes, or is it specific to public?
I believe it covers all nursing homes.
So that makes us that much better, I would assume.
That's like best in show at the Kennel Club, right? Okay. All right.
And out of the 16 measures, since 2009, all the measures have shown an increase, except for food service and dining. I mean, clearly, without question, this reiterates our biggest problem is with food service, which we will address and have been addressing.
Geraldo?
Scott, I sort of waited to the end because it was sort of an unrelated question. But I know that about a year ago, you proposed hiring another staff member to look into the Affordable Health Care Act policy changes. Have we kept up with those policy changes this year, now that it's in place? And what is the status of some of those changes being proposed by the federal government to our county nursing home?
I'm trying to remember what I talked about.
I know that we sort of shot that whole proposal down, but I wanted to know. Well, we,
This is the 40,000 a year,
right, right.
Are we talking about the compliance program?
I think that's what he's talking
Okay.
about, right, Geraldo?
Yes,
Compliance
yes.
program, yes.
So the compliance program is in place. And again, Josh Drake, who is our admissions coordinator, is also our corporate compliance officer. So we took an existing employee and gave him some added responsibilities. And that has been, over the last 2 years, a very, very busy program that we've been working with Josh and the rest of the people in the facility to implement the corporate compliance program. So that was mandated by the Affordable Care Act as a condition of participation in the Medicare and Medicaid programs under the Affordable Care Act. Am I answering your question?
I was just basically trying to understand the feasibility of us spending an additional 40,000, and what are we getting for that 40,000?
That was over a year ago, Geraldo, and this has been in place, and we had discussions on this for hours on end. And it was put in place at the board's request, and that's where we are right now. Jeff, please.
I believe, I remember the conversation, but at the time, it was determined that the staffing at the nursing home was insufficient to have a person run the program, so the idea was to hire a new employee, even though we were suggesting use a current employee, because that was justifying the cost of $40,000 per year. So even though we did it 2 years ago, we're paying it per year. And I believe that's where Mr. Rosales' question came from. It's a very legitimate question, because at the time, we were talking about having the nursing home administrator or somebody else do it to try to reduce costs, but it was pretty clear, at least from your suggestion, that we would need to hire somebody for that role because we didn't have the staffing to do it, but now that's changed. So the justification for paying $40,000 a month is kind of gone. At least we'd still have to pay something, but the amount seems a little high now that we know that there's no one actually brought on board to do it. We did do it in-house. So I think that's the crux of his question, and maybe I
That's
expanded a little.
clarification. Thanks, Jeff.
Thank you.
The amount of work that's being done with the compliance program has not decreased since the start of the program that we put in place. If the facility did not have the compliance services of MPA, Josh would not be able to take on all those responsibilities himself. The home would have to hire a full-time corporate compliance officer in an attempt to try to meet all the requirements for corporate compliance. It is a very, very complicated and daunting task to take on for someone who doesn't have any previous experience in corporate compliance. Hospitals have an entire corporate compliance department, their own corporate compliance attorneys. Nursing homes never have had the luxury of that thick middle management layer that acute care hospitals have. That's the reason why MPA put that compliance program together, is to give nursing homes the option of putting together a corporate compliance program, because you cannot go halfway in your corporate compliance program. If you're going to do it, you have to make sure you're doing it as well as possible, because the OIG has stated a non-working compliance program is worse in their eyes than not having a corporate compliance program in place, even though they say by law you have to have a compliance program in place. So you're mandated to do it. You have to do it well.
Thank you.
Okay, thank you. Is there any other questions for Scott? Thank you very, very much. We appreciate it. You'll respond to some of those questions when you get a chance, okay? Thank you. Let's move on. Standing committees, environment and land use. Please turn on your microphone. Mr. Langenheim.
I move approval of ordinance number 940, amending the rural home occupation requirements in zoning ordinance case 732-AT-12.
Have a second, please.
Second.
I'm sorry, I heard it, but I'm not sure who it was.
And I'm also calling for a roll call vote.
Okay, roll call.
No.
I have a second on the roll call.
Second.
Do I have a second? Second, okay. The motion is seconded by James. Discussion, Chris? I'm sorry, Mr. Langenheim, go ahead.
Am I ready to go
Yes,
again?
go,
Thank
please.
you.
I was going to make I
This-
think I was right.
This ca-
He's trying to explain what the resolution is.
Please speak to the motion, Ralph, sorry.
What
Go
was
ahead.
that?
Go ahead, Ralph, speak to it.
This case was deferred from the November 21st and December 19th, 2013 county board meetings and the January 23rd, 2014 county board meeting. The amendment is recommended by the Zoning Board of Appeals. The amendment recommended by the Zoning Board of Appeals is essentially the same as that authorized by the committee, but many relative minor important changes have been made to improve the amendment and make it less restrictive. The Zoning Board of Appeals has also reviewed updated rural home occupation RHO handouts with 4 completely new example RHO site plans and updated RHO application forms intended to improve the communication requirements for the rural home occupation to prospective applicants. Hensley Township has filed an official protest on this text amendment, and a 3/4 majority, 117 affirmative votes, is required to defeat the township protest. The basis for the Hensley protest is that the amendment will, quote, will affect LRMP goal number 3 entitled Prosperity by limiting economic growth and development within the county. In response to Hensley Township, 1, the Zoning Board of Appeals found that the proposed amendment will not impede achievement of LRMP goal number 3. 2, the proposed text amendment makes the existing ordinance requirements less restrictive. Not approving the amendments will retain the more restrictive requirements. I also move for a call for a roll call vote.
Thank you. Chris?
Thank you, Mr. Chairman. I move to defer this to the March full county board meeting.
Need a second, please? Second by Jeff.
Any comments?
No comment. Is there any discussion on the deferral? Jeff?
I believe we need to defer it since there are only 16 members of the body present.
Right, we need 17 to override this. So, all in favor of deferral? Aye. Opposed? Motion carries. Thank you. Move on to highway. Ms. Coward has left, but there's only a summary of action taken on February 7th. No action taken. So we'll move on to finance. Please, Chris.
Thank you, Mr. Chairman. I move adoption of resolution number 8770, payment of claims authorization.
Second by Aaron. Discussion? All in favor? Aye. Opposed? Motion carries. Chris.
Thank you, Mr. Chairman. I move adoption of resolution number 8771, purchases not following the purchasing policy.
Second, please. Second by Stan. Any discussion? All in favor? Aye. Opposed? Motion carries. Any other business? What's that? I'm sorry. Oh, I'm sorry. Yes, we have an addendum. Adoption of resolution. What would this be under? Just there would be. Oh, okay. Joel. There's Mr. Fletcher from the State's Attorney's Office.
Last fall, the board approved a partial release of judgment against a debt owed to the county by Bernard Ramos that related to a real estate transaction that is set for closing towards the end of this month. I found
I'm sorry,
out-
Joel, point of order, Mr. Chairman. I think we need a motion.
Yeah, I'm sorry. But let's, adoption of resolution number 8790, approval of partial release of judgment. I need a motion. First, Max, second, Aaron. Go.
A partial release related to a real estate transaction set for closing towards the end of this month. I found out on Monday that the title company had a concern about the wording in the partial release. There was a very minor change that I drafted that is acceptable to them. I don't believe this is a substantive change. Because it relates to a closing that could occur before the next county board cycle, I wanted to get this before the board tonight. That's why it's coming before you now without prior notice. I'd be happy to answer any questions you have.
Any questions on this issue? Patsy?
What was the change suggested?
Oh, the county's lien had been recorded twice, and because of that, they wanted both document numbers listed. It's really not a substantive change.
Any other questions? All in favor? Aye. Opposed? Motion carries. Thank you, Joel.
Thank you.
Any other business? Any new business?
When I sat down here this evening, I came to my attention that on Saturday, on February 22nd, there's a program which is going to be held at the Illinois Terminal Building, 45 East University, to discuss and to help those folks that are struggling to hang on to their home and behind in their mortgage payments and nearing foreclosure. So if this could be added to the website, so that for public information, so that those could,
They have been advertising that,
Okay.
and that will be posted as a handout with this night's materials
Okay.
on the website.
okay, great, thanks.
Jeff?
Is there a status update on the Going Wireless or Going Green County Board papers? We were going to do a pilot program with a few of the members. How is that going?
I'm still learning.
It is going. Those members all have their tablets, have been trained, and are working with them.
Okay, great, thank you.
Mine happened to run out of battery charge tonight, so I have it sitting over here charging. Sorry about that. I don't have an extension cord. Are there any other business? James, move to adjourn, second. Second by Jeff. All in favor? Aye. We've adjourned. Thank you.